Welcome to another edition of Sport and Spinal Weekly. Remember, you can get tons of information online.
sportandspinalrehab.com.
Plus, you can always email the show and request information or request a topic for us to discuss. Sport and Spinal Weekly at paulbunyan.net. Well, here we are. Is summer halfway over?
It's getting there, and a lot of people are talking about fall and school starting and summer camps.
Well, yeah, the 4th of July, we got through that. So
it's we still got a lot of summer left, but we got to be optimistic.
And you survived the storm?
Yeah, survived the storm. Obviously, our hearts go to a lot of the folks who had some damage out there, but it looks like as typical of community Bemidji is, pull together and get things done. So that's great to see.
A lot of people have been doing storm cleanup. So careful when you're moving those big trees and stuff, right, Doc?
Yeah, we've seen a lot of patients with those types of injuries, and obviously we're here to help as well. So, but yeah, you got to use good technique, and sometimes even the greatest technique, when you get yourself in a predicament, you can injure yourself. So it does happen.
Our topic today will be children and chiropractic, right?
Yeah, we're going to go in a little different direction. As we were talking off air, we've over the last few weeks have had a lot of kids in our practice. Parents bringing them in with ear infections and colic and different things like that. And it's something I don't think we've talked about here on the show, but chiropractic care has been shown to be very successful with those types of situations. And so yeah, we'll chat about that a bit.
That's all coming up this week on Sport and Spinal Weekly. All right, Sport and Spinal Weekly, we are back, and we are talking about children and chiropractic. And chiropractic's good for all human beings, right?
Well, yeah, absolutely. I guess when you say chiropractic, most people probably think about back pain or neck pain or headaches, different things like that, and that's primarily what we talked about. But chiropractic really is the foundation of chiropractic is maintaining the integrity of the spine and the nervous system. And so when you do that, oftentimes the result is you get rid of pain. And so that's, we are experts, I would say, in pain relief. But sometimes, particularly kids, sometimes we don't know that they're in pain. They might have other symptoms.
Right.
And
it's harder for them to communicate,
They can't
right?
communicate that. So it doesn't mean they may not need some adjustments to their spine. And that's kind of what we do with kids when we see them in a chiropractic setting is do a good history with their parents. Obviously, they're not going to give us much feedback, but parents will bring them in. I mentioned a couple of situations or symptoms that we look at, and that one is ear infections. We see that a lot in kids. And in our practice, we have really good success with treating ear infections.
So I'm just sitting here like, wow, what would you do? Do you rub there? What do you do?
Yeah. Well, first of all, it's a great question because, a lot of kids have ear infections. And kids are prone to ear infections because just the way the face is, just because of our anatomy when we're young. You have tubes that run from the ear to the throat called the eustachian tubes, and that allows the fluid to drain out of the ears to the throat. Well, in adults, as our face gets longer, that tube becomes more vertical. And in kids, it's more horizontal, so the fluid has a tendency not to drain out of there as well. And what we find in kids is that if the muscles in the neck or adjacent to the neck become tight, a lot of times that fluid doesn't drain as well as it should, and there's muscles actually in the back of your throat that if they become tense, many times that fluid doesn't drain as well. And those muscles all get their nerve supply from the spine.
Okay.
And so if the spine is irritated and makes those muscles tighten up, one of the effects can be some blockage of that draining to the ear.
Well, I mean, you're speaking to a parent of a, we went through that. And I think anybody that has multiple children will have one that the tubes are horizontal or not draining, and you go through that, and they don't want to put tubes in. They don't want to do surgery, but sometimes that's the only choice. But now is this a practice that's been going on, or is this something that this is something that the chiropractic industry already knew a long time? But
yeah, it's been going on for a long time. I mean, chiropractors have been treating kids for years.
Oh.
And if you look at take a look at a baby, and you may not. Parents look at things and miss things that we catch. So we'll take a look at a youngster and we'll say, well, how far can they turn their head to the right and to the left? And you'll notice, and parents are amazed by, wow, they've got their head tilted at 15 degrees to the right, and they can't move it to the left, and that's because of some misalignment of the spine possibly, or muscle tension, or whatever that case may be. And so if we can do, and then we go back to treatment. So what do? Well, we do adjustments on kids or spinal manipulation on kids. That's part of our treatment program. And certainly we use a different technique than we use on adults. It's a much more gentle technique. It's kind of a traction type of technique. There's lots of different types of techniques that we use, but it's a very gentle technique. And kids, it's amazing. They respond so well to that treatment.
Well, I suppose, their bodies are relatively still fresh, right?
Yeah, they're fresh, but if you think of the birth process,
sure,
it's a pretty traumatic thing, really. Even the best birth process is pretty traumatic. So, and then you think of a baby, and it's totally natural, but they're curled up inside the mother for that long a time, and so their spine goes through some changes when they enter this world. And so those are the kind of things that we look at, and it's really fun, and it's rewarding treating kids and seeing the relief on parents. I just talked to one today, and she brought her baby in. A parent brought the baby in for colic, or really tense and tight in the stomach, and just couldn't relax, and was constipated and hadn't had a bowel movement in 3 days, and so we do some gentle manipulation techniques and do some light massage on the stomach and different things like that, and right away the child has a bowel movement and has been good for 3-4 days now.
Really?
Yeah. So they respond really well, and because their body's dynamic, they're not, like as you mentioned, they're not kind of set in stone. So.
Well, I thought the whole colic was because of the coughing. Have babies thrown their back out, so to speak? Because sometimes they'll cough, and you just feel so bad for them. Does it have any other problems we don't realize?
Yeah, and I don't know that that's kind of the term as people that we all think of as you throw your back out, but it's really it's probably more subtle than that. It's more irritation to the nervous system, to the whole.
Oh, okay.
It's kind of your nervous system isn't working properly. There's some irritation there, so if we can remove that irritation, it's going to help with the symptoms where those nerves are going.
What about it? And I would assume that this is kind of a no-brainer, I'm sure. But as children come in, you guys look for the. We get screened in elementary for MS or whatever.
Scoliosis, yeah.
But I suppose you guys can that's automatic, right?
It's pretty second nature to us, and I don't even know if the schools do it much anymore. I know they used to do a lot of it, and I'm not sure that they do it. But that's one of the things we look for, and we'll see. Let's just say an 8-year-old. Kid, and so we do a postural exam with them, and it's amazing how many times we'll see where their pelvis or their hip is higher on the one side, and then as a result their shoulders higher on that side, and then their head tilts the other way. So if we can catch those problems early in kids, you can imagine the stress that would be relieved on their spine as time goes on.
Oh, and just a longer lifespan, I would assume, right? I mean, we're all conjuncted like that. That couldn't be good for us.
Well, I mean, the spine is a mechanical chain, and so you're not going to die tomorrow if you're not straight up and down. But the point is that if things are aligned as best they can be, then your spine, your body's going to function better and for longer and degenerate at a slower pace.
So there's many advantages of having your child looked over at least once a year in that aspect, right?
Yeah, and it depends on the particular case. Some people are really kind of into maintenance care, and maintenance care is is kind of a catch term now, where a lot of people are into wellness and maintenance.
You bet.
And I think it's a good thing, but we really leave that up to the individual patient and person.
But most people come in when they're hurting, right?
And that's the thing. And most people, and again, kids can't tell you when they're hurting, so they're going to display symptoms. So in babies, oftentimes they're restless at night. They don't sleep well. They have diarrhea or constipation, or ear infections is another one. And if we go back to ear infections for just a minute, certainly there's a couple of different causes for ear infections too.
Sure.
And you mentioned the tubes and the treatment that goes with that. Ear infections can be caused by bacteria in the ear, which, from a medical approach, then immediately go on antibiotics. And actually now a lot of the pediatricians now aren't advising that. They're saying, hey, let's let it run its course, because your body has the ability to heal itself,
right.
And if we let the immune system kind of take care of that, it makes a big difference. And so the most troubling ear infection patients that we have are the ones that have been through a low course of antibiotics, and then up to the next higher one, the next higher one, the next higher one, and then boom, they're going to talk about tubes. And so they've had so many courses of antibiotics that their immune system's kind of depleted. It doesn't know how to fight things on its own. And then if we look at another source of ear infections, and that's a viral ear infection, well, if you take antibiotics, it's not going to help because it's a virus.
True.
So the key for, I guess, one of the tenets of chiropractic treatment of ear infections is give the body its best ability to be able to heal itself. And let's boost that immune system up. And so we'll talk about getting them on some good supplements or some things that are going to really help boost their immune system to let the body fight it. And once your body learns how to fight something, your body's pretty amazing.
And does it get stronger in that aspect?
Yeah, our immune system continues to grow, and it gets stronger and
builds naturally.
And you fight off colds and flus and things like that without having to, to dip into the medicine cabinet all the time.
And that's one thing that you guys aren't. You guys don't practice, and that's something that you don't do is figuring out a different way.
Yeah, and again, I've talked many times. There's nothing against medication when it's warranted and needed. There's some cases of ear infections that absolutely antibiotics, you need them.
Or you might have the person might be you have to have a surgery because of your situation.
It could be that case. But if you can, and antibiotics work great when they're used properly. If they're used, time and time and time again, then the bacteria don't respond to it. But if you can limit the use as much as you can, and then you do have a serious infection where you need that antibiotic to work, then it works. Then they work great.
Well, certainly, but antibiotics cost money too.
They do cost money, but that's
you can't forget you got to take the whole 10 days.
But they are the that's just the nature of the beast, and when you do need something, you gotta follow through with treatment. But if you can avoid doing that in the first place and let your body take care of things naturally, I think that's a good approach.
I like that approach too. And on the website, information on the stuff that we talked about?
Yeah, a lot of information there on our website. And then, of course, people can call. Folks that have not been involved with chiropractic are a bit reluctant to bring children in many times.
I suppose.
Because of the nature is, we chiropractors crack the back or, whatever, and that's not what we do.
Kids don't have old backs. Old people have old backs.
Yeah, exactly.
I would assume.
They're not in pain, that type of thing. So if anyone wants to sit down and chat about it, just, give a call. We do a consultation, kind of explain things. And there's been some really, really good studies on ear infections in kids and colic in kids that have shown really positive results. Scientific studies, good studies that show that there's some benefit.
Oh, so why not give that a try?
Exactly, it's a good. It's another good option, an alternative to going down the road of taking medications for everything.
For the information on today's show is found online
Yeah, well, all the shows are archived as well online, so we can go to our website at www.sportandspinalrehab.com.
Or call and just don't think it's a silly question, right?
Yeah, absolutely. Call and we'll set up a consult and sit down and chat.
Like what you hear. All right, we'll be back to close out today's show. This is Sport and Spinal Weekly. All right, Sport and Spinal Weekly, and Dr. Erickson in the studio with us. Of course, if you want more information on children and chiropractic, just make a phone call.
Yeah, give us a call at 444-2117, or you can go on our website, and there's lots of information there as well.
Like we were talked about in the open today, I took 2 days off of vacation. Hard to call them vacation. It was storm cleanup, trees, mowing, chainsaws, and I was a little sore this morning. But there's a part of me that says, I need to stay active, right? I need to keep these muscles a little sore, and they won't be sore after a while.
Well, that's true, but you got to know your limits, and I guess that would be, maybe the tip of the week is to know when to say, let's slow down a little bit and take a break. Doesn't mean you can't keep doing things, but you want to take a break, when you need to, certainly. Maybe
you shouldn't try and remove a tree stump by yourself.
Yeah, get some help. Wait, it's going to get done. I mean, I know everybody wants to get done in a hurry, but it'll get done. But you got to kind of know your body can only take so much pressure before it breaks. So I would say take your time with stuff, but yet keep going.
Doctor, thanks for coming in.
All right, thanks. Have a good day.